In this video, I'm going to cover the pharmacy measure antibiotic avoidance regarding upper respiratory infection. The population that falls within the category of this pharmacy measure are patients 3 months of age and older, and the numerator per HEDIS are patients 3 months of age and older with a diagnosis of upper respiratory infection that did not result in an antibiotic dispensing event on or 3 days after the diagnosis. The exclusions for this particular pharmacy measure are as follows. First, comorbidities present at or within the 12 months prior to the encounter, including HIV, malignant neoplasms, emphysema, COPD, malignant neoplasms of the skin, and disorders of the immune system. Next is diagnosis of an infection for which an antibiotic prescription is appropriate, such as bacterial pharyngitis, on or within 3 days after the encounter. Next is an antibiotic medication dispensed within the 30 days prior to the upper respiratory infection encounter, and lastly, encounters that result in an inpatient stay. When it comes to documentation requirements for this pharmacy measure, this measure is not met if a prescription for an antibiotic is dispensed within 3 days of a diagnosis of upper respiratory infection, barring any exclusions, and this data is captured via pharmacy claims. A common insufficiency for this pharmacy measure is failing to document comorbidities and/or competing diagnoses. This list of J codes that you see over here are diagnosis codes that do not indicate necessity for antibiotic treatment. In order to assist you with different pharmacy measures, we at Arizona Care Network recommend that you review ACN's provider portal for patients identified as non-compliant for this measure and provide education for clinicians as appropriate. Educate patients and caregivers on appropriate antibiotic use and the risks of overuse, for example, resistance to future bacterial strains, and instead recommend at-home treatments to help alleviate symptoms. You can also reach out to our care coordination team, and they can provide patients with individualized support. To refer a patient, please contact us at the following phone numbers: 602-406-7226 or 855-218-3451, and you may email us at the following email address. You can also increase your performance by working with your CPC to educate your team, build workflows to chart prep and identify open gaps before a patient comes in for an appointment, and make sure you know your ACN resources available to you, for example, CPC education and support, quality measure tip sheets that are available on our website, Arizona Care Network provider portal, Arizona Care Network Care Coordination Team. You can also visit our website, Arizona Care Network, for updated 2024 tip sheets. The following picture is the picture and sample of the tip sheet associated with antibiotic avoidance regarding upper respiratory infection, and you may find that on Arizona Care Network website.